Joining us now, as she does each and every week for our weekly mental health segment, is Carrie Krawiec, a therapist at the Birmingham Maple Clinic. Carrie, thank you so much for being with us today.
Thank you for having me.
Glad to have you on, as June is National Post-Traumatic Stress Disorder Month and included a celebration or recognition, actually, of National PTSD Awareness Day. Earlier on this week, on Tuesday, that was National PTSD Awareness Day. And so as we talk about PTSD, we should first start off by discussing the similarities and the differences between post-traumatic stress disorder and the basic overlapping issues with trauma. So these are two very similar cases, two very similar issues that people may face with their mental health, but they also have some differences to them. Let's first start off by explaining the difference between PTSD and trauma.
Well, like many mental health conditions, although we're so happy that they get more and more recognition, what happens is people use the term sort of interchangeably, or they become, very casual terms. But PTSD actually describes a prolonged mental health diagnosis that happens as a result of trauma. So trauma is something that people experience, a distressing event. It could be something like witnessing a crime or an act of war. It could be like being the victim of a crime, losing a family member in a distressing way. There are sort of many events in a person's life that can be considered traumatic. And there are traumas that happen as like single isolated incidents, for example, like a house fire, or there's traumas that are prolonged, like being in a domestically abusive relationship where traumas happen successively. So trauma is about the experiencing of an event, and we would expect a person to have a reaction as a result of trauma, maybe some sleepless nights, or some agitation or fast beating heart in the days and weeks following an event. What happens with trauma is that those intense reactions persist for a great deal of time after the actual event.
And then in the case of post-traumatic stress disorder, because trauma tends to be, as you said, a little bit more of an acute diagnosis, where post-traumatic stress disorder is more of that long-term enduring of the trauma. How do those then differ in the effects that they can have on people, given that trauma can be quite severe even in the interim, but post-traumatic stress disorder is kind of more of that long-term continuous beatdown of these symptoms?
Sure. So like you and I have talked so many times before, we expect a range of feelings in all people, like anxiety, depression when something's sad, anxiety when something is stressful. Trauma is the same way. We expect a reaction when you've undergone a traumatic event. It's actually part of the way your body and mind are trained to rescue you, to ignite your fight or flight response. The difference with post-traumatic stress disorder is that heightened fight or flight response persists even in the absence of actual distressing events happening in the present, and that is what makes it a disorder.
And then in the case of how these are recognized, what symptoms may be, how can you really tell that difference if you or someone else maybe working through either just generalized trauma or post-traumatic stress disorder, if they're maybe not addressing that with a mental health professional or other physician, and are simply just living their life, continuing to feel these effects day in and day out?
You're absolutely right. For some people, the symptoms may be externalized. They may be more irritable or agitated. They may be more jumpy. You can sort of witness those things, or people can sort of recognize those things as symptoms, but some of them happen internally or in private, and those can be much harder to diagnose and much harder for even an individual person to recognize, as these are the results of trauma, especially things when we talk about fight or freeze. Freeze is that kind of dissociating, avoidant behaviors that someone may not necessarily even know they're doing it, nor do the people around them. And so it can be a trained professional can be very useful in uncovering those symptoms. Also, with things like we said, like acute trauma is perhaps some obvious one-time traumatic event where all of us sort of societally can agree, yes, that was in fact traumatic. So of course you would have symptoms related to it, but some of the more, we call like chronic traumas or even complex traumas, there's sort sort of maybe derivatives of other traumas, those can be a lot harder for people to identify. And they say, oh, I'm just like living life. And, it might not, they might not even consider them trauma, or other people in their life are saying, well, that wasn't so bad. But that the effects can still linger and the effects can still be there, and can be hard for a person to even recognize that it was in fact traumatic. They just thought it was their life.
Yeah, treating generalized trauma, I would imagine, can be a little bit tough to get moving forward, because you are unpacking so much that is perhaps a negative in somebody's life, or a constant reminder of that negative, to get to the point where you're understanding where they're at and what sort of treatment might be best for them. In terms of post-traumatic stress disorder, given that it is such a prolonged condition of symptoms, how does that make it that much more difficult to start to unpack and really figure out where you may need to go, or where another professional may need to go with one particular patient?
Well, absolutely. I mean, the act of being traumatized, especially if you were victimized in some way, is going to really upset your sense of safety. And so part of the therapeutic relationship is to create an environment that feels safe enough to even start delving into really vulnerable parts of a person's experience. And so that can be in the beginning a first hurdle. There are methods of treatment now that have, gained popularity over the last several years, EMDR being one, where part of the intervention is about giving a person those tools to feel safe and not emotionally flooded in their experience, so that they can adequately process their experiences. It's a very effective method for the treatment of trauma and PTSD.
And so what are some of the other ways that can be treated too? And how do those then work to help somebody recover, or at least reduce the symptoms that they're feeling from PTSD or other generalized trauma?
So the act of a traumatic event, especially one that, either successive traumatic events, it really changes the brain. Like we said, it causes this fight or flight response to be like sort of more easily triggered than it would in the absence. And so, helping a person retrain their brain, right, to like reassociate with things that are calming. Cognitive behavior therapy techniques can be used to help a person, reassign what thoughts and feelings they've attached to certain behaviors. EMDR, like I said, can help by kind of creating space where a person can both talk about and understand and explore their experience without feeling the intense emotions associated with them. Because sometimes the desire to not feel such intense emotions is kind of, we all sort of as humans want to do something to sort of restore sort of normalcy. And if we're feeling really intense emotions, it can make it really hard for us to think, talk, act normally, especially even in therapy sessions. So EMDR can be helpful to both separate that emotional experience from being able to understand it, learn about it, and gain some clarity on it.
Joining us on the program today is Carrie Krawiec, a therapist at the Birmingham Maple Clinic, who joins us each and every week for our weekly mental health segment. You can find more information on ways to get in contact with Carrie and the other professionals at the Birmingham Maple Clinic on their website, birminghammaple.com, and find all of our segments with Carrie Krawiec and the Birmingham Maple Clinic on civiccentertv.com/megacast. And Carrie, continue on with the treatment methods as these are being undergone, as people with either acute stress situations, or those with long-term post-traumatic stress disorder. As they're going through these therapies, what tend to be the typical timelines of outcomes in terms of how this helps them in their recovery, helps them in their day-to-day living, given that trauma is still lingering there, and it's not going to be something that you're going to get a treatment done and it's going to immediately be gone. It's still going to be there, and you're still going to need treatment over time.
Sure, there's no magic wand or magic pill to alleviate the feelings immediately. And I think, as with any form of therapy and any issue, it's really case specific. It depends on each person's history and personality. It depends on their sense of safety and comfort in therapy. If they've had successful therapies before, or if they're new to therapy, of course, those are going to be different features, really educating about the process. Right. And people's openness or willingness to try therapy is, of course, going to be another constraining factor. So it really is unique to each individual person, and each individual therapist. It will also be decide sort of like how fast they expedite versus kind of either slower, kind of steadier methodology. So that's really just dependent. So, I mean, the most successful treatment is when it is a good fit between client and therapist. So if you're with someone and you're not sure it's a good fit, either the methods they use or their own personality or style, perhaps trying another therapist may be successful, but really having that comfortable fit is one of the strongest predictors of success in treatment.
And so as a therapist, as you're treating individuals that may have undergone trauma and you're trying to develop that relationship, what steps are you taking as you're preparing to speak to them for the first time or the first few times, and as you're going into those conversations to establish that safe basis of conversation and to open them up to discussing what they've gone through and how they can essentially reprogram some of those traumatic signals in their mind to relieve them of some of these symptoms?
Certainly therapists are trained, you're assessing a person's history, their life events, or even their present and what's brought them in, and creating goals for what they need or what they identify. But also keeping in mind there are things that perhaps might be uncovered along the way. Therapists use almost like layers of the onion, right? Or like things might be unearthed that are unexpected, and just to be able to be calm, responsive, appropriate, and attuned to those things and respond as they come up. And then certainly, like I said, offering education. There's time where we may tap into something that neither you or I expected would cause an emotional reaction or would be connected to something perhaps traumatic or a memory. And then in the event when we uncover those, like this is how we will respond. And just taking time or space to notice the subtle and obvious signs that perhaps you've touched onto something traumatic, and stopping there and educating. It's almost like something surgical. If you sort of open someone up looking for one thing and then you find another, you have to sort of pause, reevaluate, and take whatever steps to make sure that person is going to be healthy and safe. And the same goes when we're uncovering emotional, historical things that may or may not be traumatic or connected to traumas in the present.
And in terms of friends or family or other people in these individuals' lives, whether they are aware of this person's stress disorder or post-traumatic stress disorder, what can they do to help these individuals along as they're undergoing their treatment, as they are unpacking some of these issues that may or may not involve friends or family or other people in what was inciting in that trauma?
Yeah, I think that perhaps one rule of thumb is that like the person who is using the phrase trauma or not is really, it's in the eye of the beholder. So that's an each person individual thing. So if someone shares an experience and says I was traumatized by this, to really be cautious to say, well, that wasn't traumatic, or that wasn't that bad, or I've been through so much worse and I don't respond the way you do. That trauma is an experience that belongs to each person individually and cannot really be sufficiently judged or denied by somebody else. That's not their place, and to just really honor what a person is telling you is traumatic, and responding to them compassionately and curiously and kind.
And especially in recent years, as we've seen collectively issues like the COVID-19 pandemic, kids being in and out of school and away from socializing, especially in those young kids as they're in their developmental years and they're not getting that normal socialization, and they're all of a sudden thrust into a highly social situation like school, or even those that have immigrated to the U.S. from places like Ukraine or Afghanistan or other war-torn nations. There's so many different things that have caused maybe acute or even post-traumatic stress disorders of late. So how much of an increase have we seen in recent years, particularly with COVID-19, of more of these cases popping up in our clinics like yours in Birmingham Maple?
Gosh, off the top of my head, I don't know the statistics on how we're seeing it, but I think that we are seeing even just, trauma-informed therapists, and perhaps the diagnosis are also increasing because someone may have been presenting in an anxious way, but not necessarily identifying one unique trauma. And now we're much more aware of what we call those C traumas, like the chronic traumas or the complex traumas, which is different than the acute traumas. And historically, a diagnosis of PTSD required, the experience of a trauma and kind of defined in a way, like we said, these sort of like one-time, mutually agreed upon traumas, the house fire, a war, a rape, something very specific. But now we're gaining the awareness that the effects of trauma can look very different for different people and be connected to a host of different events, and not even events that happen to an individual, but like what we call like transgenerational trauma, but the after effects of trauma that's happened perhaps in a generation before, such as exile, a refugee, leaving one country to another. There may be trauma associated even if you were not the first generation to encounter it.
Yeah, just following up on that, Carrie, transgenerational trauma is something that has been more and more recognized in recent years, in the recent decade, especially as being something that could affect people in those next generations down the line, even if they haven't necessarily experienced firsthand the traumas that incited those of their ancestors or other relatives. So, with that being the case, and with that being something that could affect future generations, just how do those lingering effects then pass on? How does that manifest in those next generations?
Sure. Well, it's going to impact how, like, for example, if a person is a child or young adult, when they encounter a trauma and then they become a parent themselves, their attitudes about the world, about safety, their vigilance, their anxiety, their agitation is all, of course, going to have an effect on how their own children then are raised and how their own children come to learn and understand safety, vulnerability, and those kinds of things, and may even impact the environments they put themselves in, either intentionally or as a result of stuff that's happened before. For example, homelessness, substance abuse, things like that. Those things then are going to have effects of their own.
And is that going to make them? Is that going to make these next generations, the fact that their parent or another close relative of theirs, even a couple generations out, may have faced a post-traumatic stress situation or acute stress, does that make them more likely to be susceptible to those sort of symptoms or those sort of outcomes themselves?
Well, certainly across most mental health diagnoses, that if you have a family member who has met the criteria for diagnosis, there is an increased likelihood. Of course, there's, both the issue of nature and nurture. So some of those qualities are genetic and predisposed, and some of them are about just environmental factors. So it's certainly plausible that the likelihood would increase, but there's sort of a variety of reasons why.
Carrie Krawiec joins us from the Birmingham Maple Clinic on today's edition of the Megacast. More information can be found from the Birmingham Maple Clinic on birminghammaple.com, birminghammaple.com, or join us here on the Megacast. And you can find our segments online, civiccentertv.com/Megacast. Carrie, anything else that we should know at this time about treating stress disorders, and particularly post-traumatic stress disorder, as we're recognizing Post-Traumatic Stress Month?
I think something that we've talked about before, right, is that resiliency. Resiliency is the quality of human beings that we have to bounce back from difficult and challenging things. And there are factors that help resiliency. One of them is being able to talk about and share the story, both hard and how both the parts that have been traumatic and challenging, and the parts about getting and working through them. That being able to share your story with someone is one of the factors of resiliency, which is one testament to therapy, but also to seeking support from close family members. Learning other people's stories and sharing your own helps us collectively gain from each other's strengths and courage, and knowing we're not alone, which are all protective features moving forward.
Carrie, thank you as always for joining us, and especially to talk about an issue that affects so many people in a variety of different ways and can have a number of different lingering effects. It's important to talk about these issues and be able to recognize what this looks like and what steps people have ahead of them. Thank you as always.
Thank you for having me.